Hello everyone, my name is Hannah Velez and this is my presentation for intussusception in felines. So many of you are probably asking, what is it? Intussusception happens when one part of the intestine slides into another, kind of like a telescope closing in. This can block food and fluid from passing through and can also cut off blood supply to the affected part of the intestine. How should it be prevented? Preventing feline intussusception can be tricky since the exact cause isn't always clear, but here are some general tips that may help. Regular deworming. Parasites are a common cause, so keep your cat on a regular deworming schedule as recommended by your vet. Always being careful with toys. Avoid toys that can be easily chewed apart and swallowed, as foreign objects can trigger intussusception. A balanced diet is always good. Feed your cat a high quality balanced diet to promote good digestive health. Monitor of changes. So all that means, is just keep an eye on your cat's eating habits, their stool, their behavior. If you notice anything unusual like vomiting, diarrhea, or even loss of appetite, I would definitely recommend seeing your vet. Oh, let's back up for a second. Oh, no. Excuse me. Another one I would like to add into this, and it's not a part of the slide, unfortunately, but reducing stress. So stress can sometimes contribute to digestive issues. So try to keep your cat's environment calm and stable, just so, and then it would revert back to, monitoring for any type of changes. Another common question that's asked is what diagnostic tests can be utilized to confirm the presence of the condition. And those would be physical exam. So a physical exam, the vets will start with a thorough physical exam, feeling the abdomen for any masses or signs of pain. An X-ray, they would take an X-ray of the abdominal, and it can also that would be able to show any type of blockages or abnormal gas patterns in the intestines. Even doing an ultrasound. So an abdominal ultrasound is often more helpful than an X-ray. It can visual the intestines in detail and often reveal intussusception. I would also like to talk about the expected results from the diagnostic tests from these tests. So for an ultrasound is usually more definitive, and the expected result would be a visualization of the target or the bullseye's appearance, which is characteristic signs of intussusception. And this is where one segment of the intestines is seen inside of another. Back to x-rays. X-rays might show a blockage in the intestines, like we already stated before, abnormal gas patterns, or even a soft tissue mass. However, x-rays alone are always conclusive. Physical exam, the vet might feel a sausage-shaped mass in the abdomen, which is a strong indicator of intussusception. And the cat may also show signs of pain when the abdomen is plaited. Also, treating feline intussusception typically involves a combination of supportive care and surgery. So, first steps would be, stabilization. The first steps is to stabilize the cat. This usually indicates, fluids to correct dehydration and electrolytes imbalances. Pain medications is also given to cats, for their comfortability. And then surgery. Surgery is usually necessary to correct intussusception. During surgery, the vet will, gently try to reduce the intussusception by manually pushing the telescope segment in the intestine back into its normal position. And assess the health of the affected intestine segment. If the tissue is healthy and viable, it can be put back in place. And then, of course, post-op care, and then addressing any of the underlying causes so, it doesn't happen again. Um, Yes, medications are definitely part of treatment plan for feline intussusception, both before and after surgery. It just depends on the vet and depends on what's all going on and how affected the intestines is. Um, but post-operative medications could be, pain relief medication for the cat, antibiotics to prevent infection, and anti-immunities to control vomiting may be used after, if a cat seems to be nauseous. So with all that with all that information said, I hope you guys got a bigger idea on interception and how it affects cats and their intestines. Again, my name is Hannah Velez, and thank you for watching. Thank you.